Hi everyone, my name is Haig Manoukian. I am a TA for the Norris Comprehensive Cancer Center Cancer STEM Program, which is part of the USC Medical STEM Program in JEP. And I typically teach second grade students at Vermont Elementary here in Los Angeles, but today I'll be teaching you about cancer. So the first question is, what is cancer? So cancer is a family of diseases that make people sick. And there are many different types of cancer that affect all parts of the body. And the study and treatment of cancer is called oncology. And people who treat cancer, like doctors, are called oncologists. So let's have you finish this sentence. When I hear the word cancer, I already know. So you may already know that cancer is a disease. You may know someone that has cancer or has had cancer. And you might also ask, how does cancer happen? So cancer happens when cells in your body, the cells in your body, grow out of control. And the human body, we know, is made out of cells, which are like the little Lego pieces that make up our body. Everything in our body is made of cells. And these cells have instruction manuals. Like when you open a Lego set, there's a set of instructions that you read in order to make the, let's say, Lego spaceship. Okay, so cancer happens when, let's say, those cells don't follow their directions. So, for example, let's say you get the instruction manual for your Lego spaceship, but you totally ignore the instructions and you build something totally different out of control, right? So when that happens, when the cells in your body don't follow their directions, their instruction manuals, they grow out of control, and that can cause cancer, right? So here's a normal cell in pink, and it grows normally, and then it grows way too fast and out of control because it didn't follow those instructions. And now we have a group of cancer cells. Okay, so look at the difference between these purple cells and this healthy pink cell. Okay, and when there's a collection of cancer cells, we call that a tumor. And a tumor can form in any part of the body. It's like a little lump of cancer cells. So what does cancer look like? Like I said, when cancer cells grow, they grow a tumor, which is like a lump in the body. And that can be on the outside of your body or on the inside of your body. But that doesn't mean that every lump on your body is a cancerous tumor, okay? So here's what your, like, let's say your skin. This is what your normal cells on your skin look like. And these are cancer cells. And see, you can see that there's a big lump here. Okay, so sometimes a lump on your body can be cancer, and sometimes a lump on your body can just be a lump on your body. Like if you fall and hit your head and you have a little bump on your head, that's okay. That's not cancer. Okay. So when you hear the word cancer, what's something that you think about? You might think about the hospital. You might think of people taking medication to try to help their cancer. Okay. You might also think of someone who has cancer. So for example, someone who's old, okay? So our next question is, who gets cancer? So the answer is anyone can get cancer, but people who get cancer are mostly old people or people who are unhealthy, okay? And we can't prevent cancer, but we can do certain things to lower our chance of getting cancer, okay? So for example, this person is old, and sometimes when people are old, their cells kind of get tired and they don't follow the instructions anymore. And sometimes when people have unhealthy habits like smoking or eating really unhealthy food or not exercising, their chance of getting cancer goes up, okay? So while we can't prevent cancer, we can do things to help lower our chance of getting it, like exercising, not smoking, eating healthy, putting sunscreen on when you go outside. That's really important, okay? Also, another thing that's important is that cancer is not contagious, okay? So what does that mean? So contagious. if I have the flu, right? If I'm coughing and sneezing and I have the flu and I cough or sneeze and someone is standing next to me, I can give them the flu, right? They can get the flu from me because I coughed or sneezed next to them. Okay, so that we call that contagious. A flu is contagious, or coronavirus. If I have coronavirus and someone is standing right next to me and I cough or sneeze without a mask on, they can get coronavirus from me. Okay, cancer is not like that. We say that cancer is not contagious, meaning if I have cancer and someone is standing next to me and I cough or sneeze, they cannot get cancer from me. I cannot give them cancer. So we say that cancer is not contagious. Okay, that's really important. So you can't get cancer from your mom if your mom has cancer, or your uncle. You cannot get cancer from another person. Okay. Okay. So let's finish this sentence. When I hear the word cancer, I have questions about. So what you might have questions about, how to treat cancer, how do oncologists or doctors treat cancer? And so that brings us to this slide. So there's no perfect cure for cancer, okay? But we can treat it. So there's 4 ways to treat cancer. The first way is called chemotherapy, and that's a mixture of drugs that kill the cancer, okay, in your body. The second way is radiation. Okay, so radiation is the person who has cancer goes in this big machine that kind of looks like an X-ray, and this machine puts these high energy waves, kind of like X-rays, into their body that kill the cancer cells. Okay, remember those big collection of cells, those cancer cells? It kills them with these high energy waves. Okay, the third way of treating cancer is through surgery. So surgeons or special doctors will go into the person's body and cut that tumor out. Okay, so if they have the tumor in their body, the surgeon will go in and cut that part out, and then the person hopefully will not have cancer anymore. The fourth way of treating cancer is called immunotherapy. So we all have immune systems that our body use to fight against diseases, right? So let's say a person next to us is coughing, okay? Just because the person next to us is coughing doesn't mean we're automatically gonna get sick, because we have an immune system, cells in our body that help fight these things that we come in contact with, like a person's cough or sneeze. So immunotherapy uses your own body's immune system to fight cancer cells. So here is a cartoon of a cancer cell, and here is an immune cell in your body that is fighting that cancer cell. Okay, so doctors can help you fight cancer with your own immune system. So that's the fourth way of treating cancer. So let's finish this sentence. When I hear the word cancer, I feel, okay? So you might feel sad that someone you know maybe has cancer. You might feel hopeful that the person who has cancer can be treated, right? So we wouldn't be able to treat people who have cancer without the work of Jane C. Wright. So Dr. Jane Wright was the first woman to be elected president of the New York Cancer Society because of her work inventing or discovering chemotherapy as a treatment for people who have cancer. And she was also the highest ranking African-American woman in medicine as the head of the cancer chemotherapy department and associate dean at the New York Medical College. Okay, so she was a professor in the New York Medical College, where people learn how to become doctors. And she was the head of the cancer chemotherapy department, which means she helped treat people who have cancer using chemotherapy, right? So we would not be able to treat people who have cancer using chemotherapy without Dr. Jane C. Wright's work. Okay, so that's all for this week's lesson on oncology. And next week, we will have a new topic. Thanks so much for listening.